Let's check in now with the governor for that live news conference.
And dangerous fire conditions throughout the state of California. Just to put it in perspective, we had wind gusts of 140 miles per hour. I mean, those are hurricane level winds in Kirkwood and their ridge top. 140-mile-an-hour wind gusts, 96-mile-an-hour wind gusts around the San Gabriel Mountains. And of course, those of you down in Orange County know well the extraordinary gusts that you're experiencing and just the ongoing winds. But 88 miles per hour was recorded just in Orange County. So we have these red flag warnings. The red flag warnings we anticipate to end today in Northern California. That we believe and we anticipate by 5 o'clock today for the substantial portions of Northern California, the red flag warnings will end. And in Southern California later into the evening around 11 p.m. Broadly, we will experience a reduction in the winds between now and Thursday, but the most extreme wind events, we believe, will present themselves later today in the evening, and most hopefully are behind us. So again, red flag warnings end today, Northern California earlier than in Southern California, and substantial reductions in the wind across the state by Thursday. As it relates to these challenges induced by the winds now and some of the wildfires that we've experienced, some 42 initial starts in the last 24 hours, meaning 42 wildfires had ignited just in the last 24 hours. It's an extraordinary testament to CAL FIRE that you don't know about most of those. They suppressed the vast majority of those. I'll highlight a few that we're struggling with. But again, unlike baseball World Series being played so often is the case, CAL FIRE doesn't get credit for saves. They deserve credit for saves. The extraordinary work they do every single day that doesn't generate headlines is also deserving of praise. And I just want to acknowledge that up front. With these wins, to be able to suppress 42 initial starts is a remarkable effort, and I want to just applaud their leadership and our mutual aid system up and down the state of California. But still, because of two larger fires, which I'll get to in a moment, we had at peak about 100,000 people that were evacuated, primarily in Southern California. Currently, about 90,710 are currently evacuated in the state. Most of those evacuees are in non-congregate shelters pursuant to our COVID-19 protocols. Most of them are in settings that allow people to isolate, focused on their health, not just their safety, in hotels and motels. I'll remind people this historic wildfire season, 4.2 million acres have burned, 3.2 million just since August. We're currently battling 14 major fires, and complexes still have 5,000+ firefighters working the lines up and down the state of California. Tragically, just a reminder, 31 fatalities so far this fire season, and some 9,358 structures have been completely destroyed. Many times more have been damaged, but close to 10,000, as you can see there, structures have been destroyed in this historic wildfire season. Here are the two fires that have generated understandable stress and generated a lot of attention, particularly in Southern California, both in Orange County. This is Orange County and around Irvine, 5% contained, the Silverado fire. It's taken a little over 11,000 acres, and that's a few hours ago. I imagine that number is higher at this moment. We were able to receive, and I want to just thank FEMA and our partners at the federal level and federal government for their support of our FMAG, which secures the capacity for us to get reimbursed, 75% reimbursements for suppression activity related to that fire. And that was done in a very timely way, and as always, we're incredibly grateful and appreciative of their responsiveness. The Blue Ridge Fire, also in Orange County, Yorba Linda area. This is 0% contained, 7,000 acres, also part of that FMAG that we received from the federal government. So those are the two active wildfires, primarily grass fires. There have been some structure losses in these fires, not as significant as some may have anticipated, particularly with these wind gusts over 80 miles an hour in and around the area. Again, testament to the extraordinary work that's being done by local firefighters, not just our state firefighting force, CAL FIRE. Let me just, though, extend a point of consideration and appreciation, and also a somber point. We have two firefighters that are in critical condition out of Orange County, and our hearts and prayers go out to their families and their speedy recovery. It just shows the extraordinary heroism of these men and women that go on the front lines, that quite literally put their lives on the line to protect your property and to protect your lives. They succumb to rather serious and critical injuries. And so again, hearts go out, and we're giving them all the best wishes and, of course, the best care we possibly can. And to all of our firefighters up and down the state, I know how impactful it is when one of their own is injured. And so again, stay safe and continue to do the extraordinary work that you have been doing in this historic wildfire year. Just to put it in perspective, we talk in historic terms. Just a quick update on the largest wildfire in recorded history in the state of California. I'll remind you that 6 of the top 20 wildfires in our state's history have occurred in 2020, 6 of the top 20 in 2020, the largest being the August complex, over 1 million acres. Last week, we updated you, 82% contained, making progress. A stubborn complex in partnership with the U.S. Forest Service, 93% now contained. You can see they've been able to hold the line even with the winds and keeping this in around 1 million acres. The Creek Fire, we had some issues with the winds, but we were able to hold fairly strong on the line as it relates to the Creek Fire, of course, gotten a lot of attention. This is, again, in and around the area where we lost a substantial number of trees to the drought. So you have extreme conditions. You add that wind overlay. The last 48 hours, stubborn one, 61% contained last week, 63% contained this week. You see about 24,000 additional acres that have burned. Again, partnership with the U.S. Forest Service and joint command with CAL FIRE. We continue to keep you updated on those two complexes. 14, though, active up and down the state of California, 2 new ones in Orange County, and 5,000 plus firefighters continue to do extraordinary work in these extraordinary conditions in our state. Speaking of extraordinary, I want to just applaud the leadership of the states of Oregon, states of Washington, and Nevada. We had a call, as we do with our Western States Coalition, this collaborative we put together a number of months ago in the beginning of this pandemic. Our chiefs of staff connected on a consistent basis. Governors connected on a consistent basis as well. I just had a wonderful conversation with Governor Brown on issues related to vaccine safety, wildfires, as well as some issues related some dams that we share in the northern part of our state and the southern part of her state in Oregon. We had conversations that led to consideration to join our efforts here in the state of California to review vaccines, their efficacy and safety. We announced last week a vaccine safety work group focusing on equity, focusing on transparency, focusing on building trust so that we're not playing politics with the distribution of vaccine. We're not playing with people's lives or the emotion around the vaccines and when they'll be safely available. We want to make sure it's done in a sober and thoughtful way, objective, scientific way. We have the best and the brightest. We're so proud of California. I'm so proud of this country in terms of the human resources that we have at these research institutions and institutions of higher learning. And so we worked with those governors, and they're joining now formally our safety committee. We'll be adding some of their experts as well, building out even more broadly our work group. We're really proud of that, proud of this partnership, proud of those governors and the work that they're doing in this very difficult time. And again, all of us are preparing for the distribution of these vaccines and building trust with you and making sure that they're done, not just expeditiously, and at least made available, but done safely. Accordingly, and I just remind you, this slide, the biostatistics, the experts in biostatistics and epidemiology to pediatric infectious diseases and health equity and others that are part of this work group that are monitoring these vaccine trials, just to give you again a sense of the resumes of some of the folks from UCLA, Stanford, Berkeley, and many other extraordinary institutions that are already deeply engaged with the federal government on the vaccine protocols, now more formally working with all of these other states. But we're adding a new group today, 16 members of this new group. It's called a Drafting Guidelines Work Group. This is a focus on the ethics of distribution. Who should be prioritized? How do we allocate the supplies? How do we not only do so safely, the Scientific Review Committee, but do so with a sense of urgency and prioritization of the most vulnerable related to concerns of the transmission of this disease that have comorbidities or are congregate settings, that are in our skilled nursing facilities or residential care facilities, that are most vulnerable based on age or other modalities. Those are the guidelines that we are putting out, prioritization of those cohorts and those groups. But we want to be guided, again, by experts, and we're going to be guided by experts in immunization, of course, but also geriatrics, which is foundational, ethics, epidemiology, and again, health equity and pharmacy practice. So 16 members of this work group. We just put out their names, just put out a press release. You can go to our COVID-19.ca.gov website, COVID-19.ca.gov website to learn more about the individuals that are part of this drafting guidelines work group. Dr. Ghaly will come up in a moment. He'll talk a little bit more about this group in comparison, in contrast to the safety group, as he updates you on the movement between tiers. Now our 8th week since we put out the tiered, those color-coded tiered status. He'll talk about the movement, and he'll also be updating on some of the more specifics related to the purpose of the creation of this work group and what he's hoping comes out of that work group. But what I want to update you on first is numbers you're very familiar with, numbers that have been trending slightly up. The case numbers here in the state of California, the last 24-hour period, we've recorded 3,188 total number of new positive COVID cases here in the state. The 14-day average, slightly higher than that at 3,699. And I should note that if you look at just the 7-day average, the 7-day average is higher still at 4,303. And I say that because I look at the 7-day, not just the 14-day average. Again, as I suggest, it's starting to trend up slightly. What I mean by slightly, take a look at this slide. You'll see the 14-day positivity rate. That's, again, the total number of tests that we conduct and the percentage of individuals that test positive. We are never ashamed of testing more people, and we're not ashamed of identifying those that have been tested positive, as the purpose of testing is around taking care of people's needs related to their isolation and quarantine or their medical needs. That's the purpose of testing. Again, nothing to be ashamed of. We want to substantially increase the number of tests here in the state of California, but we want to keep that positivity rate down. Even as the total number of cases go up, which I know generates headlines, the real headline for us in terms of alarm bells and red flags is that positivity rate. The positivity rate over a 14-day period is holding below 3%. It's been trending down, and now we're starting to see it go slightly back up, but still below 3%. It's at 3.2% on the 7-day. So 14-day, little bit more stability. 7-day, again, we're starting to see some modest increase. 133,000, just shy of 134,000. Average number of daily tests was 144,000. Yesterday, we got just shy of 200,000 tests over the weekend, over a 24-hour period. So we're starting to see those test numbers go up. We'll be announcing later this week efforts to substantially increase the total number of tests with our new lab facility down in Valencia, which we'll highlight this Friday. But nonetheless, the positivity rate's still below 3%, but starting to trend modestly back up. Let's take a look at hospitalizations and ICUs. Hospitalizations are also beginning to trend slightly back up. 4.7% increase over the last 14 days in new hospitalizations, as well as an increase of 5.9% in ICU admissions over a 14-day period. Now, the good news is overall statewide, we're still trending below where we've been for time in terms of total number of admissions in ICUs and hospitals. So capacity remains ample. But nonetheless, we saw weeks and weeks, candidly months or a month plus of declines, double-digit declines pretty consistently over those 14-day bands. Now you're seeing modest increases as we reverse that a little bit. We start to see some plateauing and some stabilization, slight increase over the last 14 days. So we're monitoring this. We're watching this closely. And Dr. Ghaly will come up in a moment and tell you what he's been seeing at the local level, parts of Southern California, Imperial County, in region what we refer to as 1 near San Luis Obispo, where we're monitoring some modest increases as of late. We're working very closely with those counties and their health officers and continuing to prepare for our winter months where more people start mixing, holidays, when more people start coming over and enjoying the holidays outside of their core household cohorts. And we're obviously concerned about the prospects of seeing these admissions go up and seeing these hospitalization rates go up. But what we are seeing, and I'll just briefly preview with last week's tiered status, is continuing momentum out of the most restrictive tier, purple, 12 counties last week. In the most restrictive tier this week, you'll see 7 counties. Dr. Ghaly will lay out the 7 counties that are moving through tiers. None have fallen back this week, which is encouraging. 7 counties moving through either into red, into orange, or now even into yellow, the least restrictive tiers. So with that, sort of teeing up your Tuesday at noons with Dr. Ghaly, here's his update on the tiered status and an update as well on this new work group that we announced today. Doctor?
Thank you, as always, Governor. Just before we get into the tiers, I want to spend a minute on the exciting progress announced today on vaccines. Last week, we talked about one of the first pillars of our vaccine strategy. I'll remind you that we submitted, like all states, a plan, a comprehensive plan, noted to be one of the most comprehensive plans in the nation about being prepared for distribution of the vaccine when it's ready. To the CDC and our federal partners just over a week ago. And today we're announcing that second pillar of our 3-pillar strategy, one that scientific safety review committee made up of experts in California, now joined by experts from 4 other surrounding states, that will look at the evidence, all of the data, ensure that it's complete and that we're transparent, not in any way to delay vaccine distribution, but to reinforce and support what we hope the federal government's going to share with us, which is a strong bit of evidence about the safety and all of the rigor that goes into getting a vaccine prepared for distribution to people. Today, the drafting guidelines subcommittee or committee coming together to really talk about some of those hard questions about when we only have handfuls of doses, who should get them, supporting our frontline healthcare workers, as the governor alluded to, those who are most vulnerable, those in congregate facilities, skilled nursing facilities, other places, really looking at that first group of Californians eligible to get the vaccine. And then later, as we get more vaccine, but then not enough for everyone, how do we roll it out? And how do we have these two thoughtful groups working together that, in my view, are going to prepare California to be ready when we get the vaccine. In no way delaying distribution, but preparing ourselves like few other states are going to be able to. So we look forward to that work. I look forward to hearing the advice of those committees as we guide and work with our county partners. I'll remind you, the experts are not just from our esteemed academic universities around the state, but also practical individuals at the county level, working in pharmacies, nurses who work with patients today, lots of different experts, so that we have a rich set of input from across California. So today, as the governor mentioned, normally we update the tier status by Zoom. Today, I have the privilege of doing it alongside the governor. Last week, we had 12 counties go to purple. We saw that was 2 counties that actually moved back from red tier to the purple tier. 23 counties in red last week, 14 in orange, and 9 counties in yellow. Today, we have 9 counties in purple, so 3 counties moving forward. Actually, 2 counties moving forward, and Shasta County, who we worked closely with to look at their most recent data, and worked with that county and maintained them in the red tier. We now have 22 counties in red, 17 in orange, and 10 in yellow. If we go way back to the beginning of our tier system, we had 38 counties in purple. Quite a bit of movement. Only 2 counties in yellow, now 10. So we've seen, as we've talked to you about the slow and stringent approach of our blueprint, that counties are moving through, are beginning to see some increased openings of various sectors and increasing the occupancy of those sectors that have been open for quite some time. So to be more specific, purple to red this week are Glenn and Mendocino counties, 2 counties I've had the privilege of working pretty closely with over the last couple of months to make interventions to reduce transmission, to increase testing, and to watch closely their hospital capacity. So that's important news for those 2 counties. Red to orange, Contra Costa, Marin, San Mateo, and Santa Cruz. And then orange to yellow, Calaveras County. And as the governor mentioned, no counties are moving back in the tier system. We do have a number of counties, you can see which counties those are, who we are concerned about moving back in the future. We're working closely with their public health teams and other leaders in their counties to ensure that we are digging into the data, understanding it very well, so that we can take the appropriate steps in partnership with our local partners to make sure transmission is reduced as far as possible. So I'll turn it back to the governor. Thank you.
Thank you, Dr. Ghaly. So progress as it relates to modifying our stay-at-home orders, our industry by industry, sector by sector guidelines, allowing more capacity, more ability for people to move into these new tiers. Again, we provide support and guidelines, but we do not assert that we are mandating people to move quickly through any of these tiers. We still rely on our local health officers. We rely on local elected officials based upon the conditions on the ground, based upon their appetite to support the movement. We continue to work collaboratively and closely with all of them. But good news, nonetheless, this will continue to advance our collective cause of getting closer to reopening our schools safely for in-person education. Again, We have protocols and a process in place, and we have mandates as it relates to requirements on testing and PPE that must be put into place before we can safely reopen for in-person instruction. But nonetheless, the movement that we are announcing here today, Dr. Ghaly announced, is continuing to advance that effort as, again, we continue to modify and allow for more activity in businesses large and small all up and down the state of California. I'll open up for questions in a moment. I'll leave you at the end with a short PSA around Halloween, very short 10-second PSA that we've been putting out on Halloween, because as we modify, as we go into the holiday season, as people begin to mix, I've got 4 young kids that are running around in their costumes, have been for, seems like 2 or 3 months. We've already gone through 4 or 5 completely molded, well, you all know the drill, any parents out there, how eager our kids are to buy pumpkins a month and a half out. I'd only advise people, if you do that, don't carve them, as now they have to be cleaned up. But again, I digress.
All right, you've been watching an update from Governor Newsom. Our coverage continues now on CBS and Bay Area, streaming on KPIX.com. We just learned Contra Costa, Marin, San Mateo, and Santa Cruz counties will move from the red to the orange tier for reopening. Now, as for the fires in the state, 42 wildfires ignited in the last 24 hours due to those increased winds across the state. Nearly 91,000 people have been evacuated in Southern California because of that massive Silverado fire. This comes on top of an already busy fire season that has claimed 31 lives. Close to 10,000 structures have also been destroyed. Back to the coronavirus for a bit. The governor announced a work group that will determine guidelines for the allocation of a vaccine when that becomes available. COVID numbers have also gone up slightly in California. Again, more from the governor right now on CBSN Bay Area.